Hey everyone, this is Lacey with the Your Lyme Matters podcast, and I have Christina Kantzavelos with me
Oh,
today, and I pronounced it pretty decently there from the thumbs up. Hi Christina, thanks for joining us.
thank you so much for having me on, Lacey. I really appreciate it.
You're welcome. I'm very excited. I have a feeling we're going to talk about some exciting things, maybe some medical trauma, some mental health and therapy and such. First off, I know you have a patient experience with Lyme disease and co-infections. Where are you tuning in from? People like to know where you're tuning in from.
I'm tuning in from Portugal, about
Portugal.
yes, an hour north of Lisbon.
Do you live and work there?
This is officially my second home after California. A big part of the reason I'm here is because accessibility to medical care and treatment, affordable care, and just feeling overall less inflamed since being here, just in Europe in general.
Really? I'm curious what you ponder might be the cause of that. So you mentioned California is your home. So would that if you would that make you American then?
So
Nationality.
So I am, I guess, three different nationalities. So I am Greek. Both of my parents immigrated from Greece to Canada. So then I'm Canadian citizen and working on my passport at the moment as we speak. And then they moved to California. So then American. So I have all three, which is
Multi-purpose.
exactly.
Nice.
Yeah.
I'll go back now to your professional background. What background do you have? First off, what schooling did you take to get you to where you are?
Yeah, I my first master's is in social work, so I am a licensed clinical social worker. For those who don't know, that is after you get your bachelor's, you go to grad school for at least in the US for 2 years, and you collect hours during your master's, and then you have to complete 3,200 clinical hours under supervision. It's very specific, so it's not as quick as you would think it was. It took me, I believe, almost 6 years. Usually that's kind of, I'm feeling the average, sometimes a bit longer. Post grad, getting your hours, so then you can sit for licensing exams. And then you get your license. So that's how I became licensed. But I didn't realize I was going to end up doing this at that time.
I would love to hear how you didn't know, but something helps you to know.
Even to this day, not really taught a ton about trauma in grad school. So that's something you generally have to seek out yourself. So, like EMDR training, something else I do is called constructed awareness, these different modalities that are both trauma and somatic informed, which is extremely important, especially for, in my opinion, treating anything mental health related to Lyme co-infections, chronic illnesses in general. This I had to seek out, pay for, invest in myself to help me really understand this from that whole perspective.
It's interesting. I'm curious. I don't know about psychologists if they do a lot of it, but in my backgrounds, we didn't do a whole lot of trauma either. Would you say trauma should almost be in every therapist toolkit?
100%. And I do inform folks when you're searching for a therapist to understand that it is not automatic that they are trauma and or somatic informed. It's not automatic, but I feel like it is absolutely vital because it has to do with everything. Like living in this day and age has these implications of trauma. Having chronic illness in general has implications of medical trauma because you have to face this medical system. I mean, we'll go into that, but it is a lot on the nervous system. So if you're meeting with the therapist who does not have that background, right? I always say someone can only take you as far as they've taken themselves. So if they have not done that work themselves and been trained in it, to me, it's a little concerning. That's it. That's how I feel. So
Okay.
yes, I believe it needs to be, yes, an ideal
So
world, magic wand, everyone.
I was like, the unicorn, this
Yes,
has all the tools, the
yes.
multi-purpose for the Lyme and co-infection community, or even not though. I would argue that it's beneficial even for the
For
ones not
everyone.
treating chronic
For
illness.
for everyone. And I don't even feel it's just for therapists, all medical professionals, nurses alike, right? I mean, it's just so very important. We big fan of Dr. Gabor Mate, right? He's Canadian and we love him. And he's a psychiatrist, but he is all about folks becoming trauma informed, especially practitioners, because there's a core level of wounding that has trauma.
If people Google his name, he's got some great philosophies regarding trauma. For people listening, what things do you cover as your specialties in your practice?
Constructed awareness. It's a modality that's similar to EMDR, brain spotting. It's all kind of in the same realm.
Okay.
I love it because EMDR, I mean, again, we can talk about this more. It can be tough when your nervous system is super activated. I had this personal experience, and I've heard it from so many clients, where you open up Pandora's box when you don't have the vessel, you don't have the window of tolerance to be able to be there with what comes up, and it can actually flare you. I was flared up for weeks after my first EMDR experience because I didn't know about my nervous system dysregulation. Another thing not taught to us in grad school. I had to get really sick to learn about the nervous system and the limbic system and the HPA axis and all of these things. The first thing I would say I work on is the nervous system. So if someone actually desires to work with me, I have two requirements. One is that you pick a nervous system rewiring program of your choice. Obviously, a huge fan of Primal Trust. First, I did DNRS. Primal Trust wasn't even in existence when I did it. It was like Gupta and organic intelligence at the time, and I think DNRS. So I went the DNRS route. I say wholeheartedly, nervous system work saved my life. So I'm a big fan. So I require this, but you can choose whatever program you like. I always ask that folks choose the one that resonates the most with them, because that's what's important. That means they're going to be a bit more consistent in finishing and following through. And then the second thing is working with a practitioner who's Lyme literate, or at least integrative, depending on what they have going on, so that on the biochemical end of things, they're receiving that level of support. And it's not like you have to show up and have these things done. We work on them concurrently. At the end of the day, I'm a social worker, so I am known to be the resource person. I have a resource list on my website that's free, and I'm constantly adding to it. And a lot of it is community driven, because someone will tell me about a practitioner or a treatment or some kind of resource that I can add to it that will be helpful to our community.
I would say that's very handy for you as a therapist to also have for your clients. That's a very handy thing to have for them.
My sessions don't run the typical 50 minutes to hour mark. We go until whoever I work with feels complete. And so that feeling of complete is going to naturally include often resources and helping them.
Like, you go till they don't feel completely disheveled, I'm guessing, or in chaos.
Yesterday, there was a 2.5-hour session that I did. And what we got to at the end of that 2.5-hour session, had I cut off at the 50-minute or hour mark, whatever, arbitrary mark, she wouldn't have come to that conclusion within herself. And she saw that. She understood that. She goes, wow, if you hadn't let me kept going, I don't think I would have reached this huge point within myself. And I see that on a regular basis. So generally an hour to an hour and a half is where we stop. But it's important because I also am neurodivergent. I don't like to look at the clock too much. I really like it to feel free flowing. I don't want anyone to feel like they're rushing to share all of the information from the last week or 2 weeks or a month, whatever cadence we have with seeing each other. I want it to really feel like their nervous system can just present the exact perfect way it's supposed to in our session.
Actually, my brain kind of grabs little words as you're talking, and it's like, yes, remember that. And so I was going to actually add in for you, but you added it for yourself. Rushing is the atypical nervous system trigger, especially in our population. So allowing some of that flexibility in the session right from the get-go. And then the second part is the isolation piece, because a lot of us patient people, you might be the only person we're talking to, even virtually, for 6 months, or, if we can't afford practitioners. So the isolation piece, maybe you're the person they're going to tell something exciting about their life to. Maybe you're that person.
I mean, I get emails too in between, and I really get to be a person on the sidelines of supporting them in all of these areas. I'm glad you said flexibility, because that's just the biggest word in the practice. Because back to the cadence part as well, like I said earlier, maybe I see them every week, but we don't decide until the end of session. So maybe this is going to be a really hard week. I'm getting a lot of heart infusions. Can we wait 2 weeks, 3 weeks? I'm going to be traveling or I have family in town, and whatever it is, I support whatever decision they make on when to meet with me next. And then also important doctor's appointments or things pop up or they're not feeling optimal. So I don't use canceling appointments against anyone because I totally get it. And there's almost always someone on the waiting list for the day. Again, I have to leave a lot of space in between because we go until someone feels complete. This flexibility is absolutely important and vital. And I get to work with really, really amazing humans who allow for this flexibility. It goes both ways.
The community, there's a lot of really awesome people in it, and we are in that community too. It's a great spot to land, I guess, to put it that way. I'll ask it can be a controversial question, so there's no right or wrong answer. One of the things that sometimes comes up in the community is if a patient is told they have to completely heal their nervous system before they start any types of treatment. So now I heard you say there's some flexibility. You put it at the start. However, I heard you say you kind of work along the process. Did I catch that correct? Is there anything you want to chime in on that topic? It's a little bit controversial.
No. The requirement being that they're like concurrently searching for a practitioner that's the right fit, that they're working towards a nervous system program. I mean, someone can have such horrific brain fog that like they can only tolerate literally 5-10 minutes of a program once a week. And to force a pace onto someone when the system is already so restricting and hard is the opposite of what I'd like to do. I'm just trying to put into place other supportive tools and resources so that they feel like, okay, I'm really not alone in this. I'm increasing what's in my toolbox. So the truth is, I could effectively show someone neural retraining because I've been doing it for so long. I've even created my small mini version, but it's in these programs that are 16 to 30 hours long where you get this information. And I feel like a really relatable, easy way versus even if you're seeing me for 2 hours every week, it's going to take a long time to get everything. So that's what I'm doing currently. It's just additional support. So the idea is that we are gently working towards the nervous system becoming more and more flexible. We don't want to say regulated because we want the nervous system to work as it needs to, but in a more flexible state. And then we slowly but surely begin walking in towards the body to be with what happened in our lives that placed us into a fight or flight chronic stress response in the first place. There could be many different things or reasons, but we slowly walk towards that. It's extremely paced, and I'm very much, in tune with where someone is in their nervous system to be able to go there.
It sounds like you're doing that assessment. As a therapist, you're kind of doing that assessment every second of every conversation, even though it's not loud in your head. So I would assume you're able to spot that out and pull back if you need to, if it's too fast. And I'd argue in a positive way. Sometimes when I say I argue, people are like, oh gosh, what's she going to say? I'd argue in a positive way in terms of allowing that mental health to heal. Having a practitioner is going to be key because when the cells are in threat, it's twice as much work for the nervous system, for the mental health strategies. So you're actually taking a two-pronged approach. And then you add that nervous system as they have capacity however far they go with it. That's a multi-system approach there that you're describing. So that's why I'd argue in a positive way about it.
I'm going to argue. I agree with you. Also, like while going through a nervous system program, sometimes it feels really hard and some folks do need additional support around that. And that's when I encourage them, like working with a primal trust practitioner, for example, or joining like a DNRS group. It's so important because that's just more people to interact with. I do believe we heal together. It's really true that isolation can be more painful than the illness itself in some ways. So finding ways that feel good, that are in alignment for you to interact with people who get it, who you don't have to give subtitles to, who are also working towards their healing.
Who get it is key. And you just gave a pointer to people. Try to be around the ones that do get it more if you can, and slightly less the ones that are not invalidating that if it's within your means. That's a very good pointer there. You've now mentioned you do nervous system, you do constructed awareness therapy. Right, so you do that. What other types of general therapy do you provide for your clients, just for people listening can get an idea what services you offer if they are considering coming to you as a client?
Yeah. So everything I do is trauma and somatic informed, and it's important that we are able to begin slowly but surely accessing the body to feel safeness. For some folks, this might be the first time they've ever felt safe in their body, and that can look so different for each person I've worked with. In this work, it's again finding out when and why the body began saying no, right? Because the body will whisper before it screams. And so when did it begin whispering? What was happening? What was going on? What were you like? How were you engaged with yourself, with your peers? What did that all look like? As we I say spiral around these things, because healing is not linear. I see it as a spiral. We really begin to have compassion for ourselves and our upbringing and what happened. And we are able to begin softly recognizing that, taking accountability, healing it, and then entering slowly but surely back into the body. I mean, I know for myself that like it was betraying me, and you hear that so often, my body hates me, my body's betraying me, this or that. We talk about that too. How we talk to ourselves is so big. I mean, there's research now finally coming out saying that I think there was like a Harvard research study that said self-talk can be even more potent than supplements. So that's how vital it is in how we speak to ourselves. Another piece is the fight or flight, the chronic stress response. When we begin looking at that, when and why we went into fight or flight. And it's not just fight or flight, it's a fawning response, which is people pleasing, overachieving, that type A personality portion of it. It could be also masking, especially if you're neurodivergent, that part of it. And then the freeze response, being in a state of stuckness, of not knowing what to do next, which is so easy in our medical system for us to have that response to it. But really seeing, how and why that came to be can be freeing, I think. Like when we finally are able to see what happened and look at our timeline and just be with the emotions that came up with it, man, huge shifts. You really can free yourself from it, and how that reflects to your current life.
It sounds like you take a really deep look at that root cause, essentially. So, sort of how functional medicine practitioners do it. You really take that whole, taking that data, and then you're moving forward together with your clients.
Exactly. In a way that feels good for them, just as paced as it needs to be, because everyone is just on, a different timeline that's perfect for them.
So for people listening, how would we describe, so they hear the word somatic therapy. A lot of people who are new to it may not quite understand. If we had to explain to someone listening, how would we describe that to them?
Yeah. So somatic therapy, I see it as embodying the emotions. So if I ask you, for example, if you were to shut your eyes right now and I ask you, what does happiness or excitement feel like in your body sensationally? You might say to me, I feel like a burst of energy or some warmth around my heart. It's being able to see how the mind, the body, and the emotions sort of dance and work together, how they're not actually separate. They're really, really, really integrated. And same with, if I ask you, what does sadness feel in your body? Often people will say, I feel some heaviness. I feel maybe my stomach just dropped. It's awareness around sensational responses. And it's so important in healing from chronic illness, because a lot of us press the override. When I was saying we heard the whispers before the screams, we were pressing the override button. Many of us, when our bodies were whispering, there were sensations saying, hey, might want to slow it down. This is not a good environment. This relationship is extremely toxic. I'm living in a house that doesn't feel good, or I'm with a person who doesn't actually resonate with me. There were telltale signs, but there was an override button. But I must survive, so I must keep working. I must stay in this relationship. When I worked in a hospital, that was not a good fit on many different levels, as I could look back and see that. And I wanted to get my hours. I could tell I really disliked the job so much that at one point I said aloud, I kind of hope I get sick so I can go on medical leave to have a oh, the irony. Yeah. Oh, the irony. Granted, I was already sick. I was being diagnosed with like various autoimmune diseases, and so on and so forth. But how would I override it? I was drinking a ton of caffeine when I was really just so fatigued. If I was dizzy, I just still was showing up to work, and like I had so much body pain. I mean, I wasn't taking anything heavy, but I was still taking, I mean, a lot of Tylenol and Advil, and I was just ignoring. I mean, I was going doctor to doctor, but I wasn't finding root cause physicians. They were just finding things that would help with the symptoms that weren't really helping. Migraine after migraine, and yeah, just kept clicking the override button because I have to do this. I must finish this. Oh, and it was always like this, even in grad school. I must just get through finals. So I'm just gonna, I don't even like coffee. I'm just gonna chug this, this mocha that has a ton of sugar. And I mean, I look back and I have so much compassion for myself because I just didn't know any better. Had I known those were the whispers and the warning signs, perhaps I would have, taken things a little bit differently. Perhaps not. I'm not sure.
Hard to say.
Hard to say, but I was in, unhealthy relationships, unhealthy environments. And I just kept pressing it because I didn't know what to do.
I guess I haven't asked you much about your personal, can you tell us what were you diagnosed with in terms of Lyme disease, other things?
Yeah, Lyme disease and Bartonella and so many co-infections, mast cell, anything from like mold illness, POTS, dysautonomia. And I was diagnosed with dysautonomia many years before, celiac disease, Ehlers-Danlos, HEDS, hyperflexibility, Sjogren's. There's much more. CII, cervical instability, chronic migraines, a lot of gastric challenges.
Yeah, it sounds like just hearing that, quite a lot of nervous system threats as well.
Oh, a ton of them. Yeah. So it was debilitating for a while.
What kind of primary things helped you heal medically from the Lyme and co-infections the most?
I didn't go the antibiotic route. I went the herbal route, and but still using some pharmaceuticals like long term for parasitic infections that they were finding was, it was also working for Lyme and Bart. Yeah, there'd be just various things. Well, the nervous system work. I mean, I went and did a Panchakarma in India, Ayurvedic retreat that was very intense for 2 months, and I found that to be extraordinarily helpful. Going the holistic dentist, biological dentist route was helpful. I didn't know how much the teeth played a role in the physical body, the mouth body connection. I learned so much about that. I also got to work with some later on plant medicines, which was integral in my healing journey. And then lots of IVs, ozone.
Okay. And that seems to be the thing that makes it longer is that combo platter. I call it the combo platter. But again, we've identified it's not a platter anybody ever wants to be served and eat, like with all the Lyme and co-infections, having all of them. It's the platter that you hope you never get, but those people tend to have a little bit of a longer journey to kind of put out all those fires along the way. So you had the platter, and you found some things that are helpful. I heard you mention the Ayurvedic and the holistic dentistry. We also hear can be helpful for, they just do things that regular dentists simply don't do typically. And so it can be a little less stressful sometimes if you find a good fit that way as well. I'm going to jump into the personal mental health within your comfort zone. So did it make prior mental health symptoms or conditions worse, or did it throw some completely new mental health symptoms and conditions at you? And then I can also add in, if you want a second to ponder how it worked for me, or at the end of what you say as well. You could ponder. So basically for me, it threw a medley of completely new mental health conditions and symptoms that I perhaps never would have had without the internal destruction going on and the neuropsychiatric things as well. And it also took a few things and made them worse. So for example, the anxiety, I did have that my whole life, not to that extent. It made that worse. It made depression, hopelessness, and suicidal ideations way worse. I didn't really have them before, to be honest. That was not really a regular thing. But I'm of the both. It made old things worse. And at one point I was walking my dog and I was like, I have schizophrenia. And I was like, my voice is not usually this loud and bothersome and distracting. So that was a new one for me. I did not have that symptom before. I had troubles distinguishing my own inner voice from something just loud and destructive that had popped in there. So I'm of the sect of both. However, I do hear it's gone either way for people I've chatted with. I'll pivot back to you now if you've had enough time to ponder. If not, that's okay too.
No, I think it's a really brilliant question because the mental health piece of Lyme disease and co-infections is not spoken about enough. Dr. Bransfield is amazing. He's a psychiatrist. He spoke at the last ILADS conference that I attended here in Portugal. It was so refreshing to hear someone speak on how many symptoms. Lyme has over 300 symptoms, many of which are mental health related. So if you have Lyme or suspect Lyme and are having mental health symptoms or exacerbated symptoms, it's not uncommon at all. And some of the symptoms are very much a normal response to a abnormal, horrible, horrific situation, like hopelessness, for example. When you feel like doctors aren't taking me seriously, I tried so many different treatments and they're not working. I don't feel like I've gotten better, or this doctor told me this is going to be the rest of my life, which I've had that from before, I found the right practitioners. I had a lot of that. And so of course, hopelessness sets in because they're the doctor and they know best. It's a whole other topic of discussion. With the hopelessness for me, it was feeling like, am I going to die soon? Do I have a month or two left? I mean, that really came up for me so many times because it just didn't make sense. I was just getting worse and worse. And like my mom's having to give me showers or baths. Like, what is this going to look like for me in a year, 2 years, 3 years, whatever down the line? I mean, it really challenges you just in that way. But in terms of what I had exacerbated, I mean, for sure, my anxiety, my trauma was triggered because of the medical system. Stress around finances, which also is not spoken about enough because
then speak about it, Christina.
There's little to no my
speak.
Yeah, there's little to no coverage in this, and it's called a designer disease because of that reason. It's more the folks who are affluent who have the access to the diagnostics and the treatments. I mean, it's getting better now, of course. I mean, I can see that from when I was first diagnosed. I could see how much better it is, but it is not better enough. It is not good enough. People are being left behind every single day, and it breaks my heart. Sorry, getting emotional.
That's okay. That's allowed here. That breaks my heart as well. It doesn't sit okay with me whatsoever. And so that's probably why you and I are both here, is that it doesn't sit okay with us. And we would very much like to do whatever we can humanly possibly do to help people suffer less than we did. So we really appreciate you doing that for the community. And I think people don't really understand just how difficult these illnesses can become. And then you add the financial despair. Some people understand financial despair, and there's a lot of people that don't. And so it can be a grief. It's like, what do I sell? Do I sell, my friend gave me this one piece of jewelry before they passed away. Do I sell that? That's what I was thinking about. Do I sell that to make a little bit of cash? I really don't want to. What can I do so I don't have to sell that? Stuff like that people just don't understand when they have that money and that support. And so to just validate that all around for you and everybody listening, I think they don't understand how hard it is. Christina, I would like for you to maybe try to, with words, explain some of the things for people who are still in bed and they're neurologically not able to express to their people around them how hard it is. How would you express that for them if you were their words and their brain? And we all tend to look not as bad as we are. So that's the elephant in the room.
On a funny note, when someone says, "You look so great for being sick. You look bright. You look vibrant. You're so young." Like I didn't say I was ugly. I said I was sick. And we have to laugh because it's true though. When someone is trying to, like, they have a partner or a family member who doesn't believe them, isn't taking it seriously, doesn't understand why one day you feel okay enough to show up to something and the next day there's no way you can attend. I was going to say that earlier too. I felt bipolar at times, not so much in my mental health, but in the way my mental health was reflected in my energy levels. From day to day, sometimes hour to hour, you would see me happy, and the next moment I'm like this because I'm shut down. I'm so beyond fatigued, I'm unable to function. I explain it in the way that, like, when people are like, what is it like? Like, imagine being so sick, acutely sick with something like a horrific cold, bronchitis. Let's just use that because as an example, most people know what that's like. Like, you are pretty much bedridden. You feel like crap. You are unable to take care of anything in the house. Your energy is so limited. Imagine if that just didn't stop and just went on and on. And some days were actually worse even than that, than others. And then they're like, whoa, really? Yes, really. Except you look like you don't have bronchitis.
Yeah. Yeah.
Yeah, you appear like you could be okay. And then the days you have or hours you have more energy are can sometimes be used against you. But you did
Yeah.
this last week. You did this yesterday. I don't understand. Me neither. Welcome to the club. Welcome to the club where I don't understand what this is doing in my body. Or
Yeah.
don't wish it upon my worst enemy.
Thank you for helping people because they still don't have the words, a lot of people, because as you know, neurologically, they simply can't formulate them to come out of their mouth sometimes. I'm sure some people will find that validating. You mentioned there was trauma, anxiety got worse, the financial stresses, anything else that got worse or developed as a result that you would maybe pinpoint to the infections versus simply a mental health symptom on its own or diagnosis.
I think this one's also important because you kind of briefly spoke on is the grief, the immense amount of grief that cropped up from this. The life I was so attached to the identity I had before getting sick. I worked so hard to claim that identity, and it literally, like a carpet, was just removed from underneath me. I mean, I was engaged. I mean, that relationship just faltered. I lost my house because I found I had mold in it. All of these things that came with it, it was just compounded grief over and over and over again. So loss of identity and loss of everything, friendships and who I thought I was. Those I would say were, the hardest. I also had some of the Bart or Lyme rage. I experienced a little bit of that, but I also see it now looking back as this sacred rage that needed to come out, that was underneath, that I had been masking over with people pleasing and over nice, being overly nice and pressing that override button where I never really got to be with or feel my rage. I didn't even know I had anger inside of me. I wasn't an angry person, but it was
Interesting. So have you sort of made peace with anger a bit more now, would you say?
Definitely. I now know how anger presents and feels like in my body. And I mean, admittedly, plant medicine helped me quite a bit with that and understanding that. So now when it comes up, I don't feel shame around feeling angry. Whereas before there was this correlation, like it's ethically wrong to feel these emotions. And that includes anger and rage. And no, they're just as valid and important as the other ones. Actually, it's through the rage and the anger where you can truly feel authentic peace and happiness.
And lots of, as you know, clients deal with that and they want to shut it down. It's a problem, the anger. However, we're responsible for the consequences of our anger. In this case, there's a lot of medical things without the mental health also just making us angry. If our liver is overburdened, we are probably going to be on edge, a little bit angry. If our internal cells are in the cell danger response, we're going to be depleted. I usually use the wounded animal analogy. If a dog is injured, tired, starving, and you go to pet it, what does it do? It's more likely to, and it's the same with humans. When they're suffering in pain, what are they more likely to do? Maybe not with the teeth, but same idea. So I like to use the wounded dog analogy, although I hate the idea of wounded dogs. I'm glad you mentioned grief because I would like to get your thoughts on something that we might be able to mull over together for people listening. So I've long had the thought of, grief is for sure, yes, there. But I've long pondered what happens when a person has not one grief. What we know about grief cycles is they're very up and down. But what happens when we have one grief and we start like maybe step one of the grief cycle, then we hit another grief when we're in step one of that cycle, then we maybe make it down to step two of this grief, but guess what? We didn't complete any of the first cycle, and then we had 6 more griefs layered on. And what you described, some of us have to refinance our homes. We have to move 1 to 10 times. We have to live in a tent. We have to sell our items. we lose our jobs. We may, not everybody is going to happen to. I don't want to just terrify people. We may lose our romantic relationships. You mentioned that. Our friendships. In me, I lost my competitive sport edge. I lost contact with everybody in that realm. They just simply disappeared. So we lose a lot. And so off of the top of our heads, what do you think some of the troubles with incompleted grief cycles could potentially contribute to the mental health picture?
Hit by a car and not have time to realize even what happened or to heal from that like we're looking on a physical level. And then you got hit again by another car and another car and another car. I mean, what would your body look like by the end of it? Now, just imagine that emotionally. Hit and hit and hit. So not enough time to heal, to be with the pain.
That's a very good analogy. So I say that because I want people to have that validation. You have a lot going on. Yes, there's mental health, but with these illnesses, you also have a lot of cellular things causing and inflammatory things. Whether you had mental health or not before, anybody in that acute moment is going to have mental health symptoms or similar. Can be really validating for people to hear. And you actually hit on another topic. I'll reference Maslow's hierarchy of needs. So the pyramid, it's basically all the things that by default, based off evolution theories, will put our body into fight or flight almost regardless. It doesn't really matter if you're the most healthy human being in the world and you have no trauma. It's not guaranteed. There's a very good chance it will tip you into stress response because your survival needs are not being met. What you mentioned there, one of your things falls into that pyramid. You lose housing, you lose finance, and that threatens food. And I believe, I can't remember technically, food, shelter, I can't remember them all. So basically we're in survival. And so that always makes me ask, then if you're in survival, we know our capacity is decreased age-wise or skill-wise, we regress. So then we look at the expectations we're placing on ourselves. And you as a therapist, do you find that patients are coming to you placing realistic expectations, or do you have to do some work with them about not overshooting their goals so they feel terrible when it's not attainable?
Most folks who find me are just happy to have someone who gets it in front of them. That's it. Because I might be the first and only person, you spoke on this earlier, in their life they can actually speak with, who believes them, who doesn't just hear them, listens to them compassionately and offers compassionate presence back. So no, often it's the opposite where they're like, I just want to survive this, right? But they desire to have some hope that it can get better for them in some kind of way. And if you're listening, it definitely can. It definitely can. I don't care what a doctor has said to you, it definitely can.
It definitely can. Well, I was given very low statistics at recovery or even survival a lot of the times, but at the core, it is possible. When you put all the pieces together, it gets much easier. When you understand the pieces of treatment a little bit, it gets much easier. Christina is an example, and I'm an example. I'm a 10-year journey. What year are you on now, would you say?
Yeah, this is 10 compared to how it was. I mean, wow, big difference. I say we didn't get sick overnight, so we can't expect ourselves to also just heal overnight too, right? It's really, really a journey, and no one knows the exact timeline, but I can say it can get better.
Yeah,
and
for sure.
I have so many folks who I know who are walking proof of that.
That's so great to hear. I love also chatting with people when they're starting to feel a little bit better, just to see what they're learning about themselves and looking back. It's great. You implied something that made me think of the word stigma a little bit. Would you say our population can be stigmatized? If so, how?
I think stigmatism comes up generally when someone does not fully understand a situation, a person, as well as judgment. And it can come up in so many ways. I see it especially when a celebrity gets newly diagnosed to Lyme and how people respond to that. I'm not looking for the comments, but often someone will share it with me. Like, look at how horrible these comments are. And it'll be like, Lyme isn't real. All right. Now it's technically recognized by the CDC. It's a step in the right direction. Even that was criticized within the field a bit because it could have said more and done more. But I'm like, hey, we're heading in the right direction. So let's just celebrate that.
Yeah.
But, not believing in it, not believing it's real, not taking it seriously, feeling like, people are making it up again, especially because we often do not look quote unquote sick, like using it as a way to get out of, I don't know, get out of things, not work. Like, I'm pretty sure people who are sick would do anything to be able to healthfully work. I can tell you that they do not want to sit in front of a TV all day, every day. That does not sound not actually
Yeah.
fun. Yeah. It's so frustrating that how that is somehow romanticized. I work with a lot of young people in their late teens and early 20s, and their friends go like, oh, I'm so jealous you just get to sit in front. They're like, what are you talking about? The things I would do to be able to be actually in my youth. There's so many other things, but that I can think of.
Disbelief and skepticism. What emotions or negative mental health repercussions would you say environments that are very skeptical or not believing us can cause in us as a human?
We would consider that by definition gaslighting. When someone gaslights you, it's basically challenging a real true belief and experience within yourself. I'm not feeling, but you look fine.
Yeah.
I have Lyme is not real. It it challenges our lived experience, and it feels frankly unsafe and can place us into that fight or flight because it doesn't make sense with how we are currently identifying ourselves. Not being believed feels horrific to the nervous system. It just does not feel good. It does not feel safe. Let's put it that way. I say this often. Our healing begins when someone in front of us says, I believe you. I believe everything you're saying, and we're going to figure this out together.
That's a good pull in the nervous system. Is there anything in your personal experience that you remember being gaslighted that you want to share?
I mean, I had plenty of doctors tell me that Lyme was not real. Yeah, it was just being passed around like a hot potato was just
That's
awful.
a good analogy. Yeah.
Yeah, it's like you just need to go see this specialist and now this one. And I would collect diagnoses, but it wasn't ever making sense for me as to how they started in the first place. I think it's important to say finding the right practitioner who believes you is vital and really important. And if you are working with someone in any kind of environment where they do not believe you and support you, like swipe left, move on to the next. And especially you're in the US, it's all privatized. Keep going until you find the right fit. You deserve that. You are paying them, not the other way around. And we sometimes forget that as the patient when they're not being kind to us, when they're not giving us their time, their patience, we're not receiving their support.
What might a Lyme and co-infection patient look for when they're trying to find a therapist of sorts in terms of modalities or extra training, skills, or certification?
iLads, they have a list of all kinds of practitioners who have to have essentially proven that they have lived experience and or professional experience in treating Lyme and co-infection. So there are quite a few therapists, psychologists on there, a psychiatrist at this point. So I think that's a really great place to start. There's also other Lyme associations that offer directories of, again, all kinds of practitioners. So that in and of itself gives you kind of that foundational base. Like this person is Lyme, chronic illness, literate, likely integrative. And then you can, look to see what their actual trainings are, usually they usually have websites, and you'll be able to see, are they trauma and or somatic informed? Get a vibe from their website. Is this a person that I might, because I said the goal is that you'd feel safe enough to be able to go there, to go to the root of dis-ease in the body with this person. So you definitely want to feel safe with them. And I offer free consultation. Most therapists offer this as well. So definitely take advantage of that. And that's important to see if it's a good fit, because not everyone is a good fit for everyone. I'm not a good fit for everyone. I will be the first to admit that. But for those I am a good fit for, it's amazing. It's fireworks. But we'll get that vibe from meeting with each other. And take your time. Tell a therapist meeting with a few others just to see who resonates the best and where can they meet me? Where can we go together? How does this feel good for my overall nervous system and my goals?
Very helpful. So, how does your nervous system and body feel when you're even doing that free consult call? And take advantage of that free consult call, definitely. To put into words safety for people, because a lot of people, as you mentioned, they don't know what safety feels like in their body whatsoever. And actually, I'll add, a lot of us are numb with paresthesias, and we're not able to fully feel our physical bodies per se.
I would say, do you feel more hopeful after meeting with this person? Hopeful in any way, shape, or form. Hopeful that this can be a beautiful experience, even, or this person could guide me into, healing.
Off the top of your head, if you had to choose a list, and you could choose how long the list is, but I'll say maybe 3 to 5, what would be the top 3 to 5 therapy modalities you could hypothesize might be very beneficial for Lyme and co-infection patients?
It really depends. For example, EMDR for any of my vision compromised patients, I don't do that with them, or it might still be too much for their nervous system. So it really, really depends on the patient. But EMDR is a big one. I like constructed awareness. I think that I use pretty much the most often at this point. Brain spotting would be another one. Somatic awareness and EFT.
Yep. Emotional freedom techniques.
Yes. Emotional freedom. I use that quite frequently as well. It's a really great way to get into the body. It's a beautiful way to connect with the body without overwhelming it.
And I also heard you say it is very individual, so that's fair. This is just a hypothetical situation. If you have forced to choose the top 5, these would be what you choose. But I would assume it's very important that we adjust according to who's in front of us, regardless of the top 5. I'll just repeat them for everybody. So EMDR, you unofficially tied in the nervous system there, constructed awareness, brain spotting, somatic awareness, and EFT, emotional freedom techniques. So that would be your ideal top 5 toolkit, although I'm sure you would add others if you could expand that to 10, 15, 20, or 30. So thank you for answering that. I'm not familiar with constructed awareness. Do you want to just give us a quick little summary of what it is? You did at the start, but how would you explain that if a patient's like, I've heard about constructed awareness. What does that look like?
That's why I prefer it, because it's, to me, more chronic illness friendly, and it encompasses the mind, the body, the emotions, and the environment. 3 ways in which we are oriented to the world is the environment, our bodies, and mentally. So it's finding balance within those relate to our traumas and what is happening right now in our lives. Tyler Orr, who created it, he was an EMDR facilitator, and he noticed, EMDR isn't quite the right fit for everyone. What if there was a better way? And he specializes in chronic pain. Now they've done studies that it's just as, if not more effective than EMDR. And I feel like it's just a lot less intense than EMDR can be. So I've just enjoyed working with it because of that. I'm very happy with it. And I was going to say earlier, sorry, I got my ADHD.
Oh, it's okay. All good.
You said like what things to look for in a practitioner. I would also say nervous system informed as well as being something
Okay,
important.
thank you.
Because if a therapist is not informed on the nervous system, it can be challenging to see if and when someone is ready for something like EMDR. And I was one of those. I was on the other side of the couch, and my nervous system was in no place to go there. I didn't have the vessel. I was so sick and fatigued and unwell. And we went and we opened up Pandora's box when I wasn't ready. And so I'm just saying.
And I would agree. It's very important for them to certainly know, at least know and understand about what's happening nervous system wise. And if it's not their specialty, and then they would definitely need to refer out. And I would actually also like to say that Primal Trust, that one's very comprehensive. I haven't looked at all the other ones. That one really ties in a lot of concepts for people to understand what state of nervous system they're in, dorsal vagal, ventral vagal, and then the strategy is according to what state they're in, instead of a general strategy. In terms of coping for anxiety, which many of us have in the community? Or is it the same technique for, I'm going to ask the question, for very low anxiety versus like acute panic, what you would tell someone perhaps in those states?
I tapping every single time is just is where we go and
I like that you
find
start doing it. Exactly. Yeah.
the
Thank you for demoing it.
yeah. For those who don't know, it's yeah, you are tapping on these acupressure points that really naturally are able to calm the nervous system
And I
down.
believe that is an EFT technique, correct?
Yeah, it is.
Emotional. Okay. Yeah. Perfect. So yeah, so an emotional freedom technique.
Yes. And then we start digging in deeper to the root cause of the anxiety. I'm going to use other modalities, but for someone who's in the acute experience of low grade to even higher grade anxiety, this will just really calm down the nervous system pretty quickly, like consistently. And there's so many amazing free videos on YouTube for those who just want to access this, as
Perfect.
soon as
Perfect.
possible. Yeah.
Free. We like free.
Free.
So that's
We do
that.
like free.
We
And
love free.
my resources page
Oh,
has some
okay.
links. Yeah. So
Sources
I'm
page.
constantly adding to my resources. So I'm like, I found this really good video. Okay, send it.
Oh, and your personal, is that the one that you also used coping through these illnesses the most, or did you use a mix of coping strategies?
I really began understanding the mind body connection. I began journaling a ton. I created a journal, a mind body spirit journal, because one did not exist. It's called the Begin Within Journal. Created easy prompts because my brain fog was horrible, but I was just able to write down like what I was grateful for, something I was looking forward to today, something I learned, something I loved about my body. I mean, I was just using all these little tools for myself and grasping towards healing the mind and the body. I didn't know about EFT for some years after. A lot of the things I learned were because I got, I got sick, and yeah, practicing gratitude, painting, creativity calms the nervous system so much. Singing, vagus nerve, humming, all of these
Free,
little free.
free nervous
I love
system.
free. We
Yeah.
love we love free. So there's things that are accessible, grounding, getting outside even just for a little bit and putting my feet in the ground. Eventually, I wasn't able to tolerate sun for some time, but eventually I was. And the sun, wow, I didn't realize how magical the sun was until I couldn't really access it. And then
I second not realizing how magical the outdoor environment is.
and nature is so healing. Even when I wasn't really able to walk very much, to just sit in a bench underneath some trees made a big difference. And we now know it's proven, right? We have negative ions and what they do to the mind and to the body. Nature does heal. We are nature. Music. I created a playlist for healing hurts music. It's called Hurts So Good. I'll send it to you. So I like to play that calms down my nervous system. So those are just some easy, accessible, free ways to do it. And I couldn't take baths for a long time because of the pots. I would faint, but eventually I could tolerate warmer water. So even baths were so
So
soothing.
warm. Lots of free pointers there in your journey. So you kind of were guided into this area of work. Now, did you always know you wanted to be some sort of therapist your whole life, or did that develop out of becoming sick?
I got my license. My goal in life was to work for Doctors Without Borders, to do humanitarian work. And it's really difficult. For those who don't know, it's extremely hard to, if you accept it, into doctors. Even to get an interview is like known to be near to impossible. So I made it. I got in, yes. And then a mental health practitioner, they hire very, very few compared to the doctors. So this was my dream, to do international humanitarian work. And I had already done it. I was doing work with the Red Cross and so forth. I even traveled internationally for this. This is why I was getting my license, so I could do this work. And I got in, I got accepted. I was waiting for placement. I was with another NGO in Mexico. And again, I'd already been sick for some time. It'd been getting progressively worse and worse and worse. But then I was sent to Mexico after the earthquake in 2018. And yeah, a lot of things happened, and I ended up in the hospital and had to cut my contract. And I came home, and finally, when I found the right doctor, I'm like, what about my work? They're like, that's not your work anymore. You are
Yeah.
so done. you are to, you collect you collect infections and diseases, like you don't have the vessel for
Yeah.
this type of work because you have to do a lot of medical clearances. So that was really harsh. And it was when I was healing from, I'm like, what am I going to do with my life? I'm healing from this and I'm looking for a mental health practitioner because I'm not doing well. The distress, the despair, the anxiety, everything. And I couldn't find anyone. I had such trouble. Finally, someone recommended someone in London. He didn't have lived experience, but he at least worked with the chronic illness community and Lyme community. So he understood it from that. At least having someone who understood it made a world of a difference. And that's just when I realized, like, oh man, we need more therapists doing this. And I kind of made this promise to myself, to God, if I got better from this, that I would guide people. I would guide people to do the same. I get emotional thinking about, like, I'm so grateful to be at the point where I could be able to work again and do this.
Also grateful that you're able to help with the community and that you're feeling better because you have that fusion of personal and career knowledge, and it's so helpful.
Thank you. And this goes for all of us. Someday, your survival through this will serve as a guidebook for someone else. And it's true, even if it's a small conversation, if it's an Instagram post, you might be really surprised. So, like, please keep going if you're listening. I didn't have intentions to become the therapist I am today. I became the therapist I wish I had when I was sick.
It sucks that you had to learn it that way through so much awfulness, but I'm glad. Would you say this is your niche, the Lyme and co-infection, everything that you could possibly do to improve yourself for your patients, basically for the rest of your time?
Yes, at this point in my life, and of course everything's subject to change as we know with Lyme, but at this moment in time, I can't imagine doing anything different. And it's my goal on a more macro level to be able to educate more therapists and practitioners to become competent in treating this, because you don't know how many people I get who have trauma from seeing a therapist who is not literate, who told them it was all in their head, that they were making it up. I mean, it's really horrible. Some of the stories I've heard from therapists were like, of all people, what? No, I'm working on the like in the background right now. It's taking me some time because I have to pace, but I'm working on the educational component on a macro level. How can we educate more practitioners for the sake of harm reduction and healing?
It's definitely something that would be beneficial and hopefully happens in the near future for the community, some sort of baseline for people to reference, like what is helpful for me as a regular therapist who doesn't do anything chronic illness. What do I need to do to get myself to better serve those patients? And so having that core foundation would be very helpful, key. You may not have wound up specifically with the Lyme and co-infection population had you not also been a patient. So in some ways, it's sort of guided you to where you are in better alignment with life and better alignment for your vessel. It can tolerate this better, and the flexibility of your own schedule as well.
Entirely. Like, we were talking earlier a bit about this. Like, I had to grieve so much this identity I worked hard for, like the humanitarian work. And I look back now and I'm going, like, what? Like, that was not in alignment. That was serving something that wasn't actually my true purpose, but I couldn't see it then until I got to this side. My illness brought me wellness and it brought me my purpose. I don't wish it upon anyone. And at the same time, I'm grateful for the post-traumatic growth.
Post-traumatic growth, the later stage of trauma healing for people listening in there. So Christina, in your journey now, it sounds like you experienced a lot of difficult times. What gave you the hope to just continue trying to live, trying to survive, trying to heal?
I was in the pits of despair and hopelessness, and I realized that wasn't working for me. Like, it wasn't benefiting me. I was delving into the mind body connection more and more and realizing, like, how healing hopefulness is, and having this idea and belief that I can truly heal. As soon as I claimed that and I said, this is the horse I'm riding on from now on, I feel like everything shifted and happened. There's also a really good documentary called Heal. It's on Amazon. It's free. I mean, if you have Amazon, that is. It might be free on something else, but anyway, it's called Heal. I started listening and hearing stories. This is before neural retraining. I started hearing stories of success stories of people who had healed against all odds and like various ailments. And the more I listened to stories of success versus sad stories, like I was in some Facebook groups that were not helpful to me. I realized after, they were more toxic than they were helpful and healing. But when I pivoted to the more healing end of things, we have our negativity bias and we have a positivity bias. The negativity bias is the ego. It's strong. All it cares about is you surviving. It does not care about your happiness whatsoever. And then you have the positivity bias, and they're always up against each other. And the positivity bias is like a muscle you must exercise and you must feed. And so the more I fed it, I can heal. I can do this. Even if I feel like crap today, I know someone has healed through this and has gained remission. And I kept listening to stories of remission. Really, things began to heal. I got stronger in my spiritual faith, and I just kept strengthening it that way. I don't know if that makes sense.
Your faith was an important part. I hear that a lot from people. Also, the kind of belief and the mindset, focusing on the optimism sides to not weigh heavy on the negative side, which can reinforce that brain pattern. You made an intention that we are going to switch the thoughts over this way to the more optimistic, positive side of things, as opposed to just the frequent negative.
100%. I wasn't going to be a victim of my story. I was going to take accountability and take things into my own hands and drive this thing like towards hope and success. Saying, even though at moments it felt like I couldn't latch on to anything, I still held that strong belief and that hope.
And is there anything you'd like to share with the community?
Yeah, I feel like it's what we said earlier, and it's worth mentioning again. If you're listening or watching this, you can.
Absolutely. Yeah. You can heal, definitely. And on this podcast, we'll continue giving you as much for free as we can. So there's that. Now, Christina, if people want to get a hold of you, I guess first, what country of origin do you see clients from?
I see mostly US at this point, some in Canada and Europe internationally, but mostly US. And then if you have insurance, I take insurance in California, Oregon, Washington, and Colorado, and then I'm a coach outside of those.
Basically, globally, they can do a virtual appointment with you. Did I catch that correct? Okay. And then I'm assuming all this is on your website?
Sure. It's beginwithintoday.com. And Instagram is just all socials are at Begin Within Today.
Perfect. So they can follow along if they want to see any of your insights that you post about on there. They can do so. Aside from that, anything else you'd like to say at all?
No, just thank you so much for being here and listening to us. And
you're welcome.
Yeah.
It is my absolute pleasure. Yeah.
Thank you for what you're doing for the community. It's vitally important. And you know that. So thank you for getting to the point where you can do it, because man, it takes time.
It does for sure. Yeah.
Courage.
Thank you. Yeah, I appreciate that. And yeah, vice versa. Basically, I really appreciate your vulnerability coming on a podcast and sharing it out there, because it does take vulnerability. And as you said, it becomes somebody's survival guide and validation guide. And maybe their people around them, their family and friends are not believing them. But guess what? We believe you here. So you can check out Christina's website. If you may want to do that free consult call, take advantage of those free consult calls, and there is hope.
Thank you. And I wanted to just add one other thing that I co-facilitate a free Lyme circle called the Empowerment Circle. And it's the third Tuesday of every month at 6:00 Pacific Standard Time. And it's free to the community. Anyone can attend, friends and family. I actually encourage friends and family, especially when they don't believe you, to attend, because they get to see and witness so many stories. And the focus is on empowerment and what is working for folks.
Okay.
So the idea is you do leave more hopeful. And
okay, awesome. That's good for me to know as well, because if I hear now, I send where I think it might be a good fit. So very good for me to know, and for Canadian, American, global listeners to also know that there is that support community for free as well.
Everyone is welcome. So yes.
Awesome. Yeah. All right. Well, thank you for doing that. We appreciate that as well. Yes. All right, Christina, thank you very much again for being on the podcast. Enjoy the rest of your day.
Likewise. Thank you. Thank you.